Tonight, we begin with a story that reflects not only leadership, but a powerful vision for the future of public well-being. As communities across the United Kingdom continue to seek stronger, more compassionate systems of support, one member of the royal family stepped forward today with a message of innovation and unity. Prince William, the Prince of Wales, marked a landmark moment as he visited Leeds to inaugurate an advanced facility dedicated to transforming care and research for a critical health cause. His arrival drew attention not merely because of his royal status, but because of the initiative's promise. A new model of cooperation between scientists, medical teams, local organizations, and the families who stand to benefit the most. From the outset, the atmosphere at the event carried a sense of purpose, signaling that this was more than a ceremonial appearance. It was a statement about the type of future the next generation of leadership is preparing to shape. As Prince William stepped through the doors of the newly unveiled center, he was greeted by healthcare professionals whose work has long been defined by dedication but limited by outdated resources. The new facility represents a shift toward modernized, patient-centered care, equipped with state-of-the-art technology designed to accelerate research and improve outcomes. Observers noted William's genuine engagement as he toured several departments, pausing frequently to ask detailed questions about treatment models, research timelines, and community outreach strategies. His interest was not superficial. Rather, it reflected years of involvement in mental health and wellness advocacy. By lending his presence to this project, the Prince of Wales reinforced the idea that progress in public health requires leaders who listen closely to experts and elevate voices from the ground. The staff, many of whom have waited years for such support, described the visit as both energizing and deeply meaningful. During the visit, Prince William met with families who had been personally affected by the health challenges the new facility aims to address. Their stories, often emotional and marked by long journeys through complex systems, highlighted why such an initiative is urgently needed. In quiet conversations, William expressed empathy and offered reassurance that their experiences were shaping future policy discussions. Reporters present observed the prince's ability to balance formality with sincerity, a skill that has earned him a distinct reputation within the royal family. For many families, the visit signified more than symbolic recognition. It felt like validation of their struggles. William emphasized that the success of this center will rely on continued collaboration and honest dialogue with the very people it seeks to help. His interactions underscored a central theme of the day. Progress becomes possible only when institutions and communities move forward together. Beyond its emotional significance, the opening of this facility marks a critical technological advancement. The center houses cutting-edge research labs that will support scientists in studying early indicators, treatment responses, and long-term trends previously difficult to track. Prince William spent time reviewing digital diagnostic tools, artificial intelligence-assisted analysis systems, and new data-sharing methods aimed at strengthening cooperation between hospitals nationwide. Experts explain that these innovations could shorten diagnosis times, personalize treatment plans, and ultimately save lives. William's visible enthusiasm for innovation aligns with his broader support for modernizing public services. Analysts noted that the prince's involvement helps bridge the gap between scientific advancement and public understanding, making complex developments feel accessible rather than distant. His visit conveyed the message that future leadership must embrace both tradition and technology to meet the needs of a rapidly changing world. Perhaps one of the most significant messages from the day was the emphasis on teamwork. Prince William highlighted the vital role of cross-sector collaboration, acknowledging that genuine progress rarely happens within a single institution. The new facility itself is the result of partnerships between local councils, national health organizations, private research entities, and community advocates. Standing before a diverse gathering of contributors, William praised their collective determination and spoke of the importance of shared responsibility during his brief address. He stressed that solutions to complex health challenges require unified efforts, especially at a time when public confidence in health systems faces ongoing strain. The Prince of Wales framed the project as a model for how the UK can approach future initiatives rooted in compassion, strengthened by science, and guided by the voices of everyday citizens. His remarks left the audience with a renewed sense of purpose and optimism. Following his remarks, Prince William continued his tour into areas dedicated to long-term community support, where local leaders outlined how the facility will serve as a hub for education and prevention. They explained that the center's mission extends beyond treatment and research. It aims to empower families with knowledge, reduce stigma, and promote early engagement before problems escalate. William listened attentively as volunteers described outreach programs targeting schools, neighborhood groups, and underserved populations who often face the greatest barriers to care. His presence underscored the understanding that leadership must stand beside communities, not above them. Analysts later noted that the prince's approach reflects a growing shift within the monarchy, a focus not just on ceremonial duties, but on sustained, practical involvement in issues affecting daily lives. The Leeds initiative is viewed as a powerful example of this evolving role and its potential impact. Throughout the afternoon, the Prince of Wales held private discussions with researchers whose work will shape the next decade of medical advancement. They presented findings on early treatment pathways and emerging preventative strategies, emphasizing how critical long-term funding will be. While the meeting remained closed to the public, officials shared that William expressed strong interest in supporting continued investment and ensuring policymakers understand the center's importance. His commitment carried weight. Royal endorsements often help accelerate national attention and, in turn, financial support. Outside the building, crowds gathered in the chilly air, many holding signs expressing gratitude for his advocacy. Their presence served as a reminder that public trust is built not through grand gestures, but through consistent engagement. William's visit demonstrated that he recognizes this responsibility and is preparing to bring that mindset into his future role as king. As news of the event spread, reactions from across the country began to pour in. Health experts praised the prince's dedication, noting that high-profile involvement helps elevate discussions that might otherwise remain confined to specialist circles. Community organizations in Leeds also voiced appreciation, saying the initiative validates years of local advocacy. Political commentators, meanwhile, analyzed the timing of the visit, pointing out that Prince William has increasingly positioned himself as a champion for health, mental well-being, and social reform. They suggested that his growing visibility in these areas reflects a deliberate effort to define a modernized vision of the monarchy, one that remains connected to public needs and focused on measurable outcomes rather than ceremonial appearances. While opinions varied, most agreed that the visit marked a decisive step in shaping how the next generation of royal leadership intends to operate within national life. Inside the facility, staff spoke openly about the relief and motivation they felt as the prince's visit concluded. Many have worked under immense pressure for years, navigating limited resources while supporting families in crisis. The recognition brought by today's event, they said, helps restore morale and strengthens hope that meaningful improvements are ahead. Prince William left them with words of encouragement, emphasizing that their dedication is the backbone of the entire initiative. As he departed the building and greeted crowds waiting outside, the atmosphere carried a rare sense of unity, one in which patients, professionals, and leaders stood aligned toward a shared goal. The day's events illustrated how visibility from the royal family can spark momentum, drawing attention to the people whose efforts too often go unnoticed, but whose impact shapes lives every day.